Anju is an 11-year-old girl who came to us regarding the difficulties that she has been suffering for the past 2 weeks. The symptoms that she showed were grandiosity, agitation, and distractibility appeared in the past weeks. She had no sleep, spent the nights cleaning her room, had a very short temper, or seemed extremely irritable, feeling frequent and unprovoked sadness. These symptoms rendered her totally unable to attend school and affected her interpersonal relationship. Even she had difficulty with basic needs such as hygiene. There were no recent stresses. The mental status examination showed that the child was unable to remain seated, was irritable, and had excessive talking, accelerated speech, and flight of thoughts. After the assessment, on the basis of evaluation of the symptoms, we came to know that she has been suffering from bipolar disorder. Welcome back to another episode of Connecting Pathways. In the previous episodes, we've been discussing on engagement strategies, ways to cope with stress, benefits of healthy communication, mood disorders, impact of media on adolescents, fear and anxiety, depression among children, teens, and understanding emotions. Today, we will be discussing on bipolar depression, the causes of bipolar depression, and symptoms of bipolar depression. What is bipolar disorder? Bipolar disorder is a mental disorder that causes people to experience noticeable, sometimes extreme changes in mood and behavior. Sometimes children with bipolar disorder feel very happy or up and are much more active than usual. This is called a manic episode. Sometimes children with bipolar disorder feel very sad or down and are much less active than usual. This is called depressive episode. Bipolar disorder, which used to be called manic depressive illness or manic depression, is not same as the normal ups and downs that every child goes through. The mood changes in bipolar disorders are more extreme, often unprovoked, and accompanied by changes in sleep, energy level, and the ability to think clearly. Bipolar symptoms can make it hard for young people to perform well in school or to get along with friends and family members. Some children and teens with bipolar disorder may try to hurt themselves or attempt suicide. Most people are diagnosed with bipolar disorder in adolescence or in adulthood, but the symptoms can appear earlier in childhood. Bipolar disorder is often episodic, but it usually lasts a lifetime. With treatment, children and teens with bipolar disorder can manage their symptoms and can lead successful lives. Now we are moving on to the causes of bipolar disorder. The exact causes of bipolar disorder are unknown. Research shows that people's chance of having bipolar disorder is higher if they have a close family member with the illness, which may be because they have the same genetic variations. However, just because one family member has bipolar disorder, it doesn't mean that the other member of the family will have it. Many genes are involved in the disorder and no single genes cause it. Research also suggests that adversity, trauma, and stressful life events may increase the chances of developing bipolar disorders in people with genetic risk of having the illness. Some research studies have found that differences in the brain structures and functions between people who have bipolar disorder and those who do not. Mood episodes in bipolar disorder includes intense emotions along with significant changes in sleep habits, activity levels, thoughts, or behavior. A person with bipolar disorder may have manic episodes, depressive episodes, or mixed episode. A mixed episode has both manic and depressive symptoms. These mood episodes cause symptoms that often last for several days or weeks. During an episode, the symptoms last every day for most of the day. These mood and activity changes are very different from the child's usual behavior and from the behavior of healthy children and teens. Children and teens having manic episode may show intense happiness or silliness for long periods of time, have a very short temper or extremely irritable, talks fast about a lot of different things, have trouble sleeping but won't feel tired, have trouble staying focused and experience racing thoughts, seem overly interested or involved in pleasurable but risky activities. Children and teens having depressive episode may feel frequent and unprovoked sadness, show increased irritability, anger or hostility, complaining a lot about pain such as stomach aches and headaches, have a noticeable increase in the amount of sleep, have difficulty concentrating, feel hopelessness and worthlessness, have difficulty in communicating or maintaining relationships, eat too much or too little, have little energy and no interest in activities that they usually enjoy, think about death or have suicidal thoughts. With this, we come to an end of today's episode. On this episode, we discussed on what is bipolar depression, their symptoms and causes. On next episode, we'll be discussing on the diagnosis of bipolar disorder, the treatment, and some of the ways we can help a child with bipolar disorder. Thank you and stay tuned.